Continuing on with sexual health, we'll now talk about the different types of contraception. Now, we are learning about this because it's important to understand the various ways of preventing a pregnancy. So images and notes will be up on the PowerPoint if any of you would like to jot some down. To begin with, we'll talk about condoms. Now, these come in both male and female forms and are considered a barrier contraception. Now, condoms stop sperm from reaching and fertilizing an egg, and they also protect from STIs, which are sexually transmitted infections. These can be used in penetrative sex and oral sex. We also have the combined contraceptive pill. Now, this contains synthetic versions of the female hormones estrogen and progesterone. Now, while these are usually used to prevent pregnancies, they are also used to treat painful periods, heavy periods, premenstrual syndrome, and endometriosis. Now, we also have the progesterone-only contraceptive pill. Now, this one contains no estrogen, which means it's a method that is available to those who cannot take the combined pill. An example of these people are those who are over 35 years old and those who smoke. Now, we also have implants and injections. These are long-acting, effective, reversible, and are also progesterone-only. They are over 99% reliable, and the injection is given every 12 weeks, and the implants last in the body for up to 1 year. Now, diaphragms and caps are also considered barrier methods, but they are only used by females. Now, these fit inside the vagina and they prevent sperm from passing the cervix. Now, we also have a thing called emergency contraception. Now, this is used by a female after having unprotected sex or when their method of usual contraception has failed. There are two different kinds. You've got your emergency contraception pill, which is also known as the morning after pill, and you've got the copper intrauterine device, also known as the IUD. Now, the IUD is a small T-shaped device that is made from plastic and copper, and it just sits inside the uterus. This is long-acting and reversible and can stay in the body for about 5 to 10 years. Now, this prevents pregnancy by releasing copper into the body, and sperm does not like that, so it'll stay away. We also have intrauterine system, which is an IUS. So rather than releasing copper, this one releases progesterone, and it lasts for 5 years and is also used for managing heavy periods. Now, a vasectomy is also known as male sterilization. It's a simple and reliable contraception, though it's usually considered permanent. Now, because of this, it's a big decision to make, so it was recommended to talk to your doctor, to your partner, to your family, just to make sure this is right. So, it is a quick and relatively painless procedure, and it's usually done under a local anaesthetic. Now, we also have female sterilization, which is an effective form that permanently prevents pregnancy. So again, it's permanent, so you should talk to your partner, your GP, your family, and just talk about it, find out if it's right. Now, this usually involves cutting or blocking the fallopian tubes. Now, we also have a vaginal ring. Now, this is a small, soft plastic ring that's placed inside the vagina on the first day of a woman's period. It is removed after 21 days, and then 7 days later, a new one is used. So this contains estrogen and progesterone, so it is not suitable for women who cannot take estrogen-containing contraception. Now, I do have to mention, abstinence is the most effective way of preventing an unwanted pregnancy, because if you don't have sex, you can't get pregnant. Okay, now, I would like you all to get into groups of 3 or 4 to complete this activity. So what I want you to do is to match the image of a contraception with its name. I have left a summary page on the PowerPoint app to assist you in remembering what they do. If you need help or would like anything clarified, please just raise your hand and I'll come around when I can. I'll give you roughly 10 minutes to complete this activity.